Hello my YouTube family and welcome to my channel. I'm Eleonora and today the topic is skin resurfacing laser. It's one of our most aggressive treatment and the most advanced aesthetic treatment we offer at the clinic, which we recently have been combining with other treatments, and we've seen absolutely incredible results. You can see on the pictures, this is one of my customers, and I've done quite aggressive skin resurfacing treatment, but the results have been incredible. I love that treatment. You can also see some of the feedback of some of my customers and what type of issues we can treat with laser skin resurfacing. So there are certain conditions, that we can treat. There are certain conditions we can't treat. We just have to address a lot of things. Yeah. So first of all, we can definitely treat scars. For example, acne scars. Yeah. So all type of acne scars we can treat with this laser. Also, we can treat scars that are, for example, post-surgical scars. Incredible results after laser. Scars that, for example, are from some kind of damage or maybe some trauma you've had in the past. This type of scars we also can treat with skin resurfacing laser, and I'm actually showing some pictures that you can see that. So this isn't related to scars. So any scar tissue means that destruction of a lot of skin layers. Yeah, so we have destruction of the epidermis, the dermis, and the subdermis. Yeah, subcutaneous layer or the fat layer. So sometimes it's that deep that it gets to the fat. And you know what? We know that the epidermis is a very thin layer, and the dermis is where the skin is thicker. That we have a lot of layers. So when we go through the epidermis and reach into dermis, we already are affecting a lot of skin layers and also affecting the fibroblast cells that producing collagen and elastin. And they give that skin mesh, they give our skin support, fill our skin, so we have that plumpness of the skin. So we all think about collagen, drink collagen, kind of like this is going to improve our collagen, this cream is going to improve our collagen. However, we don't understand that, it's very difficult to get to that layer and just like all of a sudden just improve it, and we can't just put more fibers under the skin. But this collagen, fibers, we can definitely stimulate. Because when the scar is formed, means that we've gone through the dermal layer where the collagen is. And when we have acne, actually our active acne is forming in the dermis of the skin. It's just where the sebaceous gland is. So if a spot erupt, if we have an acne breakout and that breakout erupt, it's going to damage all those skin layers towards the surface of the skin, isn't it? And when that happens, like obviously all those layers are damaged. Like it's very difficult for those layers to kind of like bond back together and just completely heal, and you don't have any scarring. So that's why first of all you're gonna have destruction of vascularity. So that's why you're gonna end up with this post-acne redness, which is kind of like those bluish, reddish, purplish marks. If for example the scar is even deeper, or the spot was even bigger, like cystic acne for example, or if you've been picking your skin too much, this is why you end up with like indentation, or we call box scars, big scars, or and so on. So there is a destruction of layers of the skin. So in order for us to really improve those layers of that skin, okay, to improve the layers and then kind of like make sure that we even out the skin tone, and also have that kind of like lifting or plumping of that kind of indentation area, what we have to do is we need to damage that area again. Like this is the only way you can kind of like resurface that skin. Yeah, you can get to the dermal layers, you can kind of like resurface the skin will be pushed to produce new collagen and elastin fibers, so the fibroblast cells will be activated. So what we do is, so one of the best treatments for that is skin resurfacing laser and plasma pen, which we offer in our clinic. In a lot of cases we combine those two treatments together. However, there is another treatment that we also advise our customers to have it done, which is needling, because needling will improve circulation in a better way, because we really needle the skin. We really go into the skin layers and we improve the microcirculation, lymph and blood, so to help that skin fighting and to help that skin repairing those kind of blood vascularity, those kind of blood vessels, that kind of like redness will disappear, you know, after the treatment. After each session you will see better improvement, like the skin won't be as red, won't be as sensitive, those scars won't turn like purplish or bluish. Yeah, so very much will help skin needling with the post-acne redness, we call it. But with any other scars, really it's all about skin resurfacing. And you know, the deeper you go, the better result is gonna, you know, it's gonna be. So we also tend to use some kind of like melanin suppressors or inhibitors before the treatment, like a couple of weeks, to help those melanocytes or the cells that are producing pigment suppress their activity, and you're not gonna end up with hypopigmentation. So we know we just, it depends on the individual client, individual case, so we treat this very carefully. So one of those ones are the scars. We also can treat stretch marks, which are also type of a scars. Yeah, so stretch marks are also a scar tissue. You know, the skin has been stretched to the point where it cracks, so we have literally epidermal cracking, you know, and sometimes it's even deeper, but it's not bleeding really, because you know, that means that we've gone to the dermis, but really like stretch to the point where it cracks. And the only way you can actually improve that, it's with skin resurfacing laser. Needling helps a lot as well, but better is the skin resurfacing laser and plasma device, fibroblast device, that also can do like micro kind of channels on the skin. Because when we get to those layers, we damage them again, the skin recovers, because our bodies, like our skin, has the ability to heal whatever trauma it happens, unless we have some disorder or disability. So it's very, very kind of unique way of the skin. So once the skin heals, we will be having, like, we will see that kind of recovering, a rebuilding of new skin layers, new fibers, and you know, voila, like you will see the good results. It's amazing. Can overall treat fine lines and wrinkles very effectively. Yeah, and pigmentation. So what pigmentation we can treat with our skin resurfacing laser? Because we can't treat few types of pigmentations. Yeah, so we can treat sun damage, age spots. Yeah, we can use it for like post-acne pigmentation as well, also very effectively. But also we will combine it with something else, like for example PRP, mesotherapy, skin needling, you know, to kind of like have better approach for better results, of course. And then another thing which we wouldn't treat ever with iPixel will be melasma, which is hormonal pigmentation. I've been speaking about melasma a lot. So this is a type of pigmentation that obviously shouldn't be treated with anything that is, I mean, at least most of the lasers are not suitable for that, because they generate a lot of light and a lot of heat, which we know melasma doesn't like. Melasma doesn't like heat, doesn't like any light. So we have to be very careful when we're treating this type of pigmentation. So we have other lasers for that pigmentation that are very successfully used, and we've seen great results. We have you know, skin peels. We have, you know, as you already know me, with Cosmelan peel for that. We have completely different things. You know, it depends on client. Everyone we treat individually. We can't just apply the same approach, the same plan to every single customer. It doesn't work like that. We have to work individually, because every person is different, every concern is different, every person's lifestyle is different. So we really have to look at their overall well-being, as well as also the concerns they have, and we have to address them accordingly. It's a pixelated laser. So we have laser beams, laser beam that is pixelated. So we have a lot of small laser beams penetrating the skin through the epidermis, reaching the dermis. Yeah, reaching the dermis, because we can also sometimes see bleeding. So that means that we've gone through the epidermis. We are causing controlled trauma, because we have places where the laser penetrates and the places where laser doesn't penetrate. So the skin is healthy. When the skin is healthy on those layers, this is the skin that will help the other skin to heal and repair from inside, creating more collagen and elastin. So we are creating holes into the skin. If you can just imagine, you know, this is the laser, this is the skin. So we're creating holes with the beams. Those beams are going into the skin layers. And first of all, they damage the skin cells that are, you know, basically they are penetrating. Once they are damaged, the healing process starts. So we have few stages of wound healing that will, you know, we're gonna go to homeostasis, inflammation, proliferation, and remodeling, maturation. So we have those 4 stages of skin healing, wound healing. That happens, and more skin is produced, more skin layers are produced, more skin cells are produced, and they're healthy, they are plump, more collagen and elastin is produced. That plumps up, pushes the old layers, the skin scabs off, and we have that plumpness of the skin. Of course, 1 session is not enough. We need course of treatments, sometimes 3, sometimes 4, sometimes 5, sometimes 6. It depends. Sometimes we can only do, like, let's say 1 or 2 all over the face, if that's the area we're treating. And then we can just focus on areas on the 3rd, 4th, and 6th session that are very damaged. Like, for example, if you only had it on the cheeks and a little bit here on the temples, we'll only treat that area, and maybe a little bit on the forehead. Because once we've gone all over, we've kind of like evened out the skin, and now we just have to work on those, like, selective parts. It's erbium EAC laser, which means that it's mainly absorbed by the water of the skin. So it's quite superficial. It works on the epidermis, and it can also reach the dermis, but it mainly works on the epidermal layers, kind of stimulating the bottom layers to produce. But like the damage is like mainly on the epidermis and a little bit the dermis as well. Yeah, so we can see also the dermal layers because the skin is whipping, so we can, you know, we definitely are affecting the dermal layers because we have whipping, we have some plasma, we have some blood coming from the skin. Maybe not on the exact, sometimes you can see like little dots, but then, you know, might have this after the treatment. You can see some kind of like pictures from my customers that, you know, skin is whipping, skin is like, you know, going through these kind of stages and, you know, really improving. It's very unique way. Can I do laser skin resurfacing on all skin types? Yes, you can do the laser skin resurfacing on all skin types. Of course, we need to be very careful with darker skin types. We have to lower the settings, but absolutely you can do it. Our customers with dark skin types, we have to put them on a special kind of ingredients, like creams, some kind of like topical solutions just for suppressing the melanin, because, you know, it has to be done, and then avoid any hyperpigmentation or side effects, like worse, you know, kind of like outcomes. So we are careful with that. Is laser skin resurfacing treatment painful? So you will definitely experience some kind of heat on the skin. So we can numb the skin before the treatment, which I prefer not to, just because the heat comes after the actual treatment, not really during the treatment. So during the treatment you won't feel as much, but after the treatment you will kind of like that whole heat will kind of like build up, and you will feel that kind of like wave of heat, which it feels like a burning. Your face is on fire, but it's not the end of the world. It's only going to last for about 15 to 20 minutes. Yes, the face will be very red, but that's it. We apply on the skin something that will help the heat to be taken away, and then we use you know, some kind of healing creams after the treatment, and the client is you know, kind of like been taught to kind of apply this cream every day, morning and evening. No water, so dry healing is better for this type of wounds. No water should be applied on the skin for a few days, or like by the time the skin recovers, because what I've discovered is, after, you know, years of, you know, doing case studies and trying to kind of like really understand better that treatment and deliver best results to our customers, I would just say that this treatment is like the best is to leave the skin to dry heal as long as possible. So by the time the scabs come off by itself, you need to leave the skin to heal and at peace, because the longer the scabs stay on the skin, the better the results. The more collagen fibers will be produced under the skin, the more plumper effect, and overall effect will be much better. If you want to see more videos like that, please subscribe to my channel. I will be posting often any kind of educational video related to aesthetic treatments, lasers, and any kind of needling treatments as well. So thank you so much for watching. and I will see you on my next video. I wish you have a wonderful, wonderful, wonderful day. Thank you. Bye bye.